I will text him.
Okay. He said to make sure we give him a minute so he can tell us when he
Yep.
starts. And apparently we were going to be on YouTube as well as whatever else. So I said, yeah, thanks. I didn't even do my hair.
Being recorded.
Okay, we started, so we're all set.
Thank you. So I will call the meeting to order. It is 6:33, and we can do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All righty, thank you. So I will ask, has there been any community input, Lucy, that we need to consider or think about?
Like always, Nancy, we have no community comments or input.
Great, thank you. Okay. So I will move right on to the director activity report.
Oh, agenda and minutes first, or minutes, right?
Oh, I'm sorry. You're right. I didn't write that down. So we need to approve, take a look at the minutes from our last meeting, which was September in person.
I lost you. I can hear you, but I accidentally hit something.
Okay. We can hear and see you.
We can hear you.
Okay.
Yeah.
Keep going then. You don't need to see me.
So we can see you actually. Maybe you can't see us. We can see you.
Okay.
Okay, so we would like to, I will entertain a motion once everybody's had a chance to look at the meeting minutes. A motion to accept them as written.
I make a motion to accept the minutes.
Okay, Deb, and a second from
I'll second it.
Allison. All righty, and all those in favor say aye.
Aye.
All righty, thank you. So we have accepted the meeting minutes, sorry. Now we can move on to the director's activity report.
Okay, so September, we received our first call from DPH regarding a mosquito that tested positive at one of our testing location in Trumbull for West Nile.
Oh.
We also got a call. We had one for testing positive for triple E at one of our location, our only location there.
Oh,
right.
So, just no human cases, obviously nothing like that, but just they make us aware so that we could be more vigilant and, so that, we can prepare accordingly and
the locations would have been like one of our parks or one of our pools?
The testing location is located on Cranberry Lane. It's a state testing location. That's where ours is located.
Okay. Okay. Wow. All right. But we didn't have to take any action.
No, there's no action to take. And, it's throughout much of Connecticut now that the mosquitoes have tested positive, but no human cases.
Okay.
So that's a good thing.
Okay, great. Thank you.
Other things, let's see. We've been busy with our flu clinics.
Yeah, I saw you've got 1 month. You had quite a few.
We've had a few.
72. Yeah.
We did, let's see. In September, we gave out 72. Let's see, just the numbers. We did over 80 flu vaccines. As of yesterday, the last I spoke with Sam, it was over 200 that we gave out.
Okay.
So we had more today, so I'm sure their numbers are up.
Yeah.
Still not as busy as it was years previously. A little bit busier, I think, than last year, or about on par with last year. We're thinking same thing. It's pharmacies. You drive anywhere down the street, you go to your grocery store, and that's what everybody says. Oh, when they come into the department, they think it's so wonderful, it's so great, but everybody's just going to the pharmacy because it's
Yeah.
just, it's
Is
easy,
there time
right?
tomorrow, by the way? I need to get mine.
Tomorrow, I think we do have a clinic tomorrow. I don't have the schedule in front of me.
Okay.
But I think
It's 10 to 12 and 2 to 5.
thank you,
Say it
Taylor.
again.
10 to 12 and then 2 to 5.
Perfect. Thank you. Well, you'll see me. All righty. Perfect.
So that's what's going on with the flu. We have, obviously we're going to be doing this all through October. And then we'll see how November goes, whether we're going to continue to hold clinics or just do bigger clinics. We have Board of Ed clinic coming up.
And that's always well attended.
Not as, not like it was.
Okay.
So we're working on new things to, so we're spicing up our social media. We're putting it out there as best as we can. But it's just not, for whatever reason, again, this year, it's just
But
not
there,
what
I
it
think
was.
too that we're still talking about vaccine fatigue. I think people just, they really got tired of, oh, I had this vaccine and that vaccine, and people have kind of gotten, unfortunately, not realizing how important they are. That's why I think your media campaign, is so valuable, because we need to keep that in people's minds that, yeah, maybe the flu is down or maybe this is down because you're getting your vaccine,
Right.
Yeah.
And, that is still successful, that campaign. They continue to add information on, particularly about pertussis. And they're just, they've reached out to all the directors to do any last minute media interviews and things of that nature. So that's working well. Let's see, what else was there?
I interrupt your chain of thought.
Oh,
Sorry.
that's okay. I spoke about this last meeting, but we have two part seasonal individuals who are working on our social media page and our pages and are working on our website. So we're, just focusing more on reaching a broader art audience with more information. So they've been working on that. Our website, there's a lot of things to keep up to date, to remove, to add. So we have her working on that. What else with flu? I'm trying to think. There was something else. That'll come. I'll think about it. It'll come back to me. Then in my report, I also added, we've started with the new billing company.
Oh, yes.
Finally went live with that. So no issues yet, but again, early on in the flu season, right? So we've been meeting with them, doing trainings.
Them training us in terms of how to use the
How to use the
system.
platform, exactly.
Okay. Mm-hmm.
I started working on a strategic plan for the department, which is just it's like a 5-year plan for our goals for the department. It
Okay.
analyzes, our strengths, our weaknesses, things like that.
The SWOT, the strengths, weaknesses, opportunity, I'm trying to remember, but SWOT, right?
Yes, exactly.
Yeah.
So that's something I've been working on. I also added some information about, I told you I would add some interesting things. So there's just information about more follow-up on that boar's head outbreak.
Yes.
I don't know if you read that, but I thought that was interesting.
Yes.
The conditions that they found in the plant, and now they're looking to bring possible criminal charges against them.
Wow.
So that was
Yeah, I saw that. I saw that.
and
Were
then
there any deaths as a result? There
I-
were.
10. I read in the paper there were 10.
yeah, there's
Wow.
some, not, not near here, but
Right.
so I think that's what they're looking for, the criminal charges, to bring the criminal charges against that.
Wow.
Another report released shows that the drug overdose deaths decreased in 2023 for the first time in 5 years. So we're finally seeing numbers going down in terms of overdoses.
Now, I read that, and I had a question for you. Do you think that like the Narcan in services have helped with that, or what's the reason why it can't be less fentanyl use, or maybe it is, but is
I
it because
think
of the Narcan?
Narcan could be one. I think that they are cracking down a lot harder on the fentanyl.
Oh, okay.
So, I mean, it could be just that, like you said, the outreach, a lot more education, that it's more available. However, that's a newer thing. So,
Mm. Okay, but I was curious. I mean, it's still certainly, a lot of overdoses,
yeah.
but, it is decreasing. And so you would like to look at what is the reason for it decreasing and do more of whatever that is, if it's the Narcan education, or is it stopping it, at the border, or, whatever. Yeah, thank you. I
Yeah.
read that. Yeah.
Then another report I thought was interesting was regarding the laboratory results of um, the food market in Wuhan, China.
Yes.
That there's a strong possibility that the animals that they found present were linked to infection at the market.
Yeah.
So a little bit more insight on the origin of that pandemic.
Mm-hmm.
We also purchased that's what I was going to say before it came to my
Okay.
mind. We did purchase a small amount of COVID vaccine.
Okay.
So we have some Moderna. Taylor probably knows better than I think we've given out 10. No, we bought 10 and given out just a few, correct?
We bought 50 and now
50.
we're more than halfway through our supply of
Oh,
for
all
adults.
right. See, I told you she would know
But-
better than that.
We bought 10 pediatric.
Oh, 10 pediatrics. Okay.
Now,
Good.
is it still that the bottle, once it's open, you have a short period of time to use it, or are they individual doses now, or has that changed?
So we have, correct me if I'm wrong, I think it's individual doses, right, Tay?
Karen's shaking her
I
head yes.
think it is, but I think
Okay.
it's individual vials.
Yeah, they come
Yeah,
in
that's what I
individual
think we have
pre-filled
too.
syringes.
Yeah,
Oh, okay,
they're
Allison.
individual
The
doses.
COVID
Yeah.
does?
It does. When we do the flu clinics, Sam always has to grab them and they
Okay.
come in pre-filled syringes.
Yeah.
Okay.
The VFC, the children's doses,
Yeah.
get that free from the state.
Yeah.
And then we had to purchase the adult supply.
Okay. Now, I'm sorry, I should know the answer to this question, but I'm, I guess, a little bit outdated. Can you give are you giving COVID and flu vaccine at the same time, or you can?
Yep.
Okay. And then waiting on the RSV, or?
We're not carrying the RSV.
Okay.
Because again, the cost of the vaccine is still high,
Okay.
for us on the COVID.
Yeah.
So it's
And
about,
for
our
the-
cost is about, say, 150 a dose, so.
Oh, wow, okay.
Yeah, so we ordered we had money left in the budget, so we ordered some so we could see if there was an interest in it and a need.
Mm-hmm.
And so yeah, so it's not flying off the shelves, but it's doing better than I guess what I thought. I didn't think we went through that much, but they've been put on social media, and then when people are coming in, at least we have it so that if they want it, they can get it right then and there.
And the VFC for the children, are we doing that RSV or no?
No, we're not doing
No.
that. No.
Okay. Just the COVID and the flu.
Right, that's
and
not offered.
It's not one of the.
It's not, no.
Okay.
the government just released that they're giving out more free at-home test kits for COVID. So that is posted as well. Same thing, covidtest.gov. So people could go on and get more of those if they would like.
Just a note on those, I did order a bunch for myself and I send them to my parents and my in-laws. And all three of us all got sent expired ones.
Me
Yeah.
too.
There's
Yeah.
an insert that says they've extended it, but
I was
these are
gonna
from
say.
like 2023. So
Yeah, I had heard that they said they were expired. You
yeah.
know, the I mean, in my mind's eye, I mean, it's a good thing to know if you've got COVID, but they changed the what to do if you have it so much, and it's been so in flux. And also, then we don't know if someone takes a COVID home test. We don't know really how many people have COVID, and we don't really have valid statistics about that. So, am I correct in saying that now, if you have COVID, the only issue is you just wear a mask?
Just don't go to work until you have to be fever free, without medication for 24 hours, and your symptoms have to be improving. So it's
Okay.
basically, if you don't feel good, you don't go to work, or go out, just like anything else.
Okay.
And Nancy, they're also still testing like wastewater, and that's how they're tracking if it's still higher in certain locations, certain counties, states, things like that too.
Oh, thank you for letting me know that. Okay. Okay. Thank you. I mean, we talked about wastewater being tested for something else, E. coli or something. What did we test? Or maybe that was a conversation I had with someone else. They were testing.
Well, they're talking about using it to test for other,
Yeah, it was.
yeah.
Caffeine was one of the things they were testing, and I can't remember why. I read something. They were testing wastewater now for a lot of different things, which had significant meaning, which I'm sorry, I'm blanking on what it was, but it was kind of interesting. So they are testing that for COVID as well.
Mhm.
Thank you.
Sam and Sue have been working with the TAG group, the Teen Advisory Group.
Yeah.
We still have quite a few teens that have been in attendance, and a couple of them have helped out at one of our flu clinics. So they've gotten quite a lot of interest in that. So they're working with them to figure out some more programs and ways that they can earn some community service hours.
Great.
Narcan, Sam she trained 58
Wow.
people, and they gave out 58 Narcan kits.
And I'm sorry, I keep interrupting you, but do we know who we're training? Are these like, obviously not their emergency responders, but are they parents who think that their children might have a problem, or are they
We
family
can't, we
members?
don't ask that information. So
Okay.
she does it with, it's with Teapot. So they go out
Okay.
to different events. So, one of the events she goes out to all the time is the farmer's market,
Yeah.
and advertise, and whoever wants to, sign up and do the training can receive a kit.
Okay. So you get trained and you get a kit,
Right.
but we don't necessarily know why the person was interested in being trained,
Right.
which is fine. I mean,
It's kind of a personal, I wouldn't
yes,
let them ask it.
absolutely. And if we did ask people, they might be reluctant to get trained, and then
Right.
you're defeated your purpose. Yeah. I just wondered if there happened to have been any, if we had any thoughts on the subject.
The way I look at it is it's across the board because it affects so many people that you probably have one of every group, whether it's a mother or a teacher, you know what I mean?
Yep.
Um,
Yeah.
So, but
Absolutely.
I think it's a good thing because obviously, like we had talked about, the rates are going down. So that has to lend something to the reason, right?
Yeah, absolutely. Absolutely. And you don't want to bite off your nose to spite your face, right?
Right. The sanitarians, they have been busy doing all kinds of things.
Yeah, I saw that too.
The latest we've had, what, Guacamole Grill, that was our latest restaurant that just closed. So,
Where are they located?
they're in the mall in the Trumbull.
Okay.
So we're not sure what is going in its place, but we heard that there has been some interest. We have received a few calls regarding insect traffic in the mall. So
Oh.
they have been out and met with the management, the restaurant managers and owners, just to kind of do walkthroughs to see what is being done and what more can be done. So that's something else that they've been busy with, just to
Mhm.
give you insight. A lot of times, there's when these places go under and then they're vacant, even if it's these department stores, it attracts a lot of this activity. So just making sure that really the mall and management and everyone's just staying on top of it as best that they can, right?
Mhm. Mhm. Particularly if a restaurant closes and they don't clean it properly before they leave, they just kind of exit or
Exactly.
whatever. I would think that could be a huge deal.
Exactly.
Mhm.
Another thing I wanted to talk about, they just sent out an email yesterday or the day before, the board appreciation dinner. It was last year, this month, but it's going to be November 18th. That's the 10th
Oh,
date. It's a Monday. And I
November.
don't know anything else right now, but I just wanted to let you know so you can make plans and see what your
Okay.
availability is.
Okay, recognition.
And I think it's usually at what, 7 o'clock at
I
Tashua?
thought I thought it was 6, but maybe it
six.
is 7.
Can't remember.
I'm not sure.
Um,
And you said Tashua again?
they didn't release anything yet with an invitation, but I'm assuming I
Okay.
don't expect it to change.
I have a church meeting, but I'll see if I can't make it to both or
Okay.
part of each or something like that.
As soon as I hear more, I'll let you know, obviously.
Thank you.
All right, that's it. I don't know if you have any questions.
Any questions from the group? Anything else that we'd like to ask Lucy? As always, you and your team are very busy and doing a great job. And when one busy thing falls off your plate, something else comes right back on. So you're all constantly busy, and it's an amazement at how much you are able to do and accomplish with your small team. Any other questions that anybody has for Lucy? Okay. Is there any old business that anyone would like to bring up? We talked about the new billing system, which you're in the process of learning. Anything? We also talked about the social media and the vaccine advertisement, I'll call it, which is a very great use of our money. Anything else under old business anyone would like to bring forward? Okay, is there any new business that anybody wanted to bring forward or ask a question, or Lucy, anything that we can help you with? Yes, Allison.
Just a quick update. I know I always bring this up here, but the Trumbull Public Schools are participating in Pink Pledge again this year, where
Oh,
we pick a
great.
day and they donate $1 or hopefully more to wear
Yeah.
pink. And this year it's going to be on Friday, October 18th. All the
Okay.
schools are going to participate, except with the exception of Tech, which is the preschool in town. And
Oh.
they are doing it on Tuesday, the 15th, because they're they're AM and PM, and so they don't have both groups on Fridays.
Okay.
So they're going to do it on Tuesday. So looking forward to it again.
Yeah, great. Now, if we don't have a child in school, but we would like to donate, how do we do that?
Yeah, so we publish a lot on social media. I could even send a link around to this group and just put it in the
Okay.
email.
Yeah.
And any donation is appreciated.
Okay, super. Well, I mean, this is really something that you individually started and now has blossomed throughout the town of Trumbull. So you can certainly be very proud of, you know, you had an idea and it grew, and it supports certainly women of every age and social economic background, whatnot. You know, we really have not gotten rid of breast cancer. We haven't. And we've maybe changed some of the treatments, and we've maybe, you know, done some of that, made it a little bit easier. But yeah, my sister, I have 3 sisters, 2 of which have already battled breast cancer, and my mother. So yeah,
Sorry to hear that.
thank you. But they're, you know, everybody's doing well. But, you know, we work so hard at battling cancer, and it just, you know, it's like whack-a-mole. You know, you fix one thing and another thing pops right up, right? So thank you for your efforts. I think it's really humbling that you've done this and you've made a difference. So yeah, it's okay to send out the link, right, Lucy? Is that a conflict?
Yeah, I was just gonna say to Allison too, just send us anything that you have and we can post it on all of our.
Yeah, I think you guys did that last year, which was
Yeah.
super
Oh,
helpful.
okay.
So
Just
yeah,
make sure
I'll
you
send it
send
around.
us that.
Terrific. All righty. So no other new business, no other questions for the staff. Thank you to both of you and the whole staff for all you do. If there's nothing else, I will entertain a motion to close the meeting. I see the Phillies are winning so far, 1-0, but we will not give up hope.
I'll make a motion to adjourn the meeting.
Adjournment, Allison, and a second. Karen, and all those in favor say aye. Aye. All righty. Thank you again to everyone. Thank you for all you do. Thank you for your contributions. Thank you for your volunteerism. And we will meet next month on November 6th, which is the first week of the month, in person at the health department.
Sounds
All
good.
righty.
Thanks,
Okay.
everyone.
Thank you, everyone. Paul, we're leaving the meeting.
Good night.
Bye-bye.
Good
Just
night.
leaving.
Go Mets.